let's see some indicators to measure SDG 3 in Mozambique. Inequality by equity, so let's see what this table actually suggests. So under this SDG 3, these indicators are listed over here. You can see them: 3.1.1, 3.1.2, 3.2.1, etc., etc., till the last. And then we have inequality by equity stratifier. So that is that like a parameter on which it is being measured. And then national average inequality score. So with this it will be tallied. So you can see maternal mortality ratio, socio-economic position. This has like a green and 1. So you see this note, what it says: a value of 1 green indicates information is available. 2 yellow needs some information, like incomplete data. 3 means there is like a data gap, no data is available. Gray boxes include not applicable. So red means no data available. So you can see all of this like a portion here is having a lot of red, and in this side, if I see in this column, racial or ethnic group wise, there is no green, not even yellow, it's all red. So there is no information of this type. Okay, and in the first 4 the data is available except this. In rest of the all other parameters, socio-economic position, education, sex, age, urban, rural, and province wise. Okay, but beyond this there are issues. Here it is good, here it's good. Excuse me. Then this range is not good, data is not available, right? And here also incomplete data is there, right? So it kind of hinders, by this kind of stats we are able to see what is happening where, to what extent, to which group, which person, which community, which country. Okay, this we cannot comprehend, because if some effort is going to come from UN or WHO or any other like a government of India, for example. Okay, if they want to put up some effort on to a COVID related treatments in particular state, okay, how do they know up to what extent and what kind of things are needed, that well, unless they get some data, some feedback, right? So giving this a data in completeness is essential. So this one must understand the importance of data. Further, we have summary of main topics addressed by Australian environment sector policies. So let's see what do they say. Topic and details of SOI in the environmental sector policies. So we have population growth, size of population, where the population lives and how people live. Climate change as a risk to environmental system, economic productivity and human health. Air pollution, particularly as associated with increased population growth and car dependency, major sources of air pollution. Land use, well, in India also I think is nothing new. Like whenever the a winter season arrives, most of the places, mainly in the northern Indian region, this air gets started accumulating. Okay, and that harbors these effluents and these gases and all those emissions more, and situation becomes actually worse. And this is happening for last several years with no respite. And yeah, so efforts are on from all the sides, and you may have seen arrangements, temporary arrangements being made to control it. Land use, risk associated with land clearing and potential environmental impacts of new infrastructure developments. Soil and water quality, implications for food production, industry and health of species. Water management and use pertaining to a range of aqueous environments such as rivers, lakes, wetlands and oceans. Management process, human uses and associated risks. National parks and other protected areas, because those are the only now reserved areas free from a human intervention. Well, human intervention is even there, but not so much. Okay, so very little human interventions. Those are the only regions left, pure raw nature, what we can call. Importance of controlled use of support conservation, biodiversity and tourism. Economic opportunities associated with managed use of these areas. Renewable energy. As a green industry with potential to reduce climate change impact and support transition in employment. So how to move from coal based or all of those thermal and hydro and all these disasters, nuclear, like a base, to maybe more cleaner, more safer, like a energy, generation methods. That part. Heritage and crown land, preservation of historically and culturally significant sites, rules to permit culturally significant activities in national parks, and co-management of land and Aboriginal and Torres Strait Islanders. So this is from Australia. So like hear this word Aboriginals. So these are the like original inhabitants of that whole like the Australia as a small continent, right, and New Zealand here. Okay, and then the Europeans actually arrived and they claimed the whole land and they got like a settled, so they are known as like settlers. Okay, so their rights, their this thing, and same thing like happened with them like other places also, like southeastern, like Southeast Asian countries, Southern Asian countries like India also is one of them like victims. Okay, and African nations, America also, if you see, is the like the colony of European countries, which later became like a present day United States of Americas. So the point is how to preserve like those cultures also which has fallen like behind the time. Now they are not so developed, the people from that culture not so developed and advanced. Like Aboriginals, if you see, they still like like maintaining their own like a lifestyle, their own ways of like a livelihood, like and bringing stuff and nature based like a things. Because if you see, humans have thrived on this planet for thousands and lakhs of years, like unknown years, like humans have lived. But in the last 1 or 2 centuries only, the day like Europeans started like visiting like a far away shores, far away like a countries, started colonizing them, and they brought in the industrialization. This whole problem actually began. Okay, so how to like reverse this problematic like things and all that, and those intervention and correct them, because we need to preserve those cultures also. I think in this advent a lot of cultures have like simply been like eaten up by like these like a colonist and like invaders. Okay, so all of most of those like people and communities are almost like gone, or they are extinct or about to getting like extinct. So the point is, with the like help of UNESCO and all such initiatives at global level, how to preserve historically and culturally significant sites and even people. Because what you are going to do with the sites if there are no people who are associated with those sites, because it will be just a place of tourism for you, right? But place of tourism and someone's like a habitat, two different entirely kind of like a different context kind of like a things. Okay, so saving like those Aboriginals and saving like those things also have found place in the Australian government or like organizations led like initiatives. That's why like we must appreciate, at least now they are like talking about it, like saving them. Habitat destruction as leading to species decline and or to extinction. Okay, so like we saw, like there are thousands of like species on the brink of extinction. How we can stop that? Resources exploration and production, impacts of exploration of oil, gas and coal associated with like environmental risks, environmental events and disasters, particularly bushfire and storms, but also floods and droughts, often linked to climate change, because you may be aware of like El Nino effect and all of them. Okay, well, majority of these like impacts are getting credited to climate change, so such things are actually man-made, directly man-made. Well, perhaps not all like the people on this planet, maybe a selected few, but how to like hold them responsible and help reversing like this process and bring back the normalcy. Okay, so typically it is called as like a humankind is responsible, and all the people the humans are responsible, but perhaps not all the humans. You must focus these Aboriginals or the tribal people or the people who are living in the villages and town areas whose impact is very little. How can you hold them accountable for like a climate change related like a mess? Their footprint, their carbon footprint, their energy footprint, their like emission footprint is running in the negative. So definitely they are not the responsible ones. The people who are responsible, or the countries like Qatar, is the like highest impacting country in the whole world. They should be like held responsible, and such countries, such agencies. So if you start tackling like identified problematic and like a generation like a point wise, then you will be able to come with the solution. Because if you just beating around the bush, nothing is going to happen. You need like actually surgical like a solutions to address like such problems, right? For the waste, well, excessive waste generation, like consumerism has risen like anything in the last like a few decades. Ineffective handling of resources and stuff, waterway pollution, potential for reuse, etc. Yeah. Okay, now coming down to conceptual framework, urban health related SDGs within a HIAP approach, health in all policies. So there are like a 17 SDGs listed over here, and in this the third one has like a direct like this thing, urban health, since we are talking about like SDG third, right? So how about health of like the whole place? Okay, so direct relation, if you see, apart from this there is to this one, 11th, housing, infrastructure, communities, cities, planning, all of them. So housing, transportation, land planning, air quality, green and public spaces, risk reduction, these are them like a direct impacting like a targets which connect directly with the health of a place, urban health in this case, right? And you can see the like a targets under like a third SDG third, and then there are like these indirect like relations. So for example, in the first one we have 4, 1.1, 1.2, 1.3, 1.4, eradicate extreme poverty, etc. 2.2 here, 4.8 here, 5.1 here, 6, 1, 2, 3 here, 7.12 here, 8 here, and then here. So these are actually direct related or indirect related targets. You can see the listen here, directly related upon like urban health issues, and indirectly related to urban like issues. So these are the two like sets of like targets listed down. So if you are working for improvement of health services with like WHO or maybe government of India's enterprises, or in like a MCI, or in like a in these bodies as in like a health professional, or maybe a contributor to these like a sector. Okay, from SDGs perspective, which targets to tap. Okay, so policy related things, if you want to like address related to health, definitely you should refer to 17.14, 17.16, 17.18. And if you want something related to decision making, you should refer to 16.7, participatory decision making, then 13.1, 13.2, and so on. So this actually slide gives you like effort. If you want to frame your like a project or assignments, maybe you can refer to this if it is touching health services. Here also we have like this relationship like of like these 17 SDGs to each other, like how they are related. Okay, so the few are at sustainable scale. You can see with this green category we have 6, 14, 13, 15. Then the reds we have like a fair distribution, and then we have efficient allocation in the yellows, building a living economy. Okay, so these are the SDGs at the bottom on this side, and these are the ecological economics like a frameworks. Okay, so 3, 1, 2, 3. So in this one talks about natural capital ecosystem services, this one talks about social capital community services, and net economic contribution, GPI is the GPI 2. Okay, so under this which are directly related, indirectly related, that you can see over here. Let me move ahead. Yeah, this is like a systems model, like a full world model, as you can see the title, where it talks about how this whole things are like related to each other. Okay, so if you see this like external, this dark green like a boundary is the system boundary as we undertake exercises in LCA. Okay, and the input which is coming from outside is the solar energy that gives like light, heat, and everything. I think the whole life is sustained by our sun. Okay, and inside this whole system what we emit out is the waste heat which goes like to the space, and rest of the things are contained in this like this dark green like system, what we call it as materially closed earth system. So there is only one intake and one out, one like exit wala point. Rest of the things are contained under this boundary. Well, what are those? Restoration, conservation, education, training, research, institutional rules, norms, building, they are all feeding to natural capital, human capital, social capital, built capital. Okay, together this is leading to ecological services and amenities, and from here it is going to health and well-being like this thing at individual or community level. Okay, from here there is another decision making this diagram, this rhombus you see, economic production processes. So from here it directly also leads here, or through GDP also it leads, goods and like services, you can see through this means, or by waste. Then finally it goes towards like a consumption, investments, they also lead to the like a overall health and well-being of the individuals and community. And yeah, in the feedback loop you see what is coming, the investment from this side, which goes and feeds again to like these like things, and it feeds again to the capitals also. Okay, so this is the systemic map. Further, we have a high quality health system framework. So for people, process of care that leads to quality impacts, better health, confidence in system, economic benefit. Well, all three are like advantages. Competent healthcare systems, positive user experience. So like we saw during COVID-19, sometime our health system was working very nicely, very perfectly, but when the number of contract cases went very high, okay, that became catastrophic, and the health system was on the brink of collapse. Well, it did not collapse, but it was like a very highly pressured, right? So if that system has like that resilience capacity to meet like such demands, we will have confidence in the system, which will lead to a better health with this its care, which leads to finally economic care also, economic benefit also, because like a healthy people will contribute more, diseased people are going to be the burden, right? Very simple. Well, this leads to the like how you can like make it like a resilient and efficient and equitable. So like some foundations are given over here: population governance, platform, workforce, and tools. In this, what do you need and what are the components, and together like this like again it leads to the like a good like a strong healthcare system, which will again come back cyclically, right? So this is the like a correlation. Another correlation: setting of care conditions, demographics, and they are interrelated. They help each other, they complement each other, they drive each other. Okay, so dimensions of vulnerability, poor quality care. So settings of care: humanitarian crisis and refugee camps, internally displaced people, prisons, migrant populations. Demographics, all sorts of age, sex, ethnicity, orientation, ability, etc. Conditions: reproductive health, HIV/AIDS, mental health, substance abuse, etc., etc. So finally, we have come to the last slide. So we are all aware, we come from different places, different like locations, maybe cities, towns, villages and things. So maybe you can have a look around your own place and have a general like observation. What are the challenges at your place with respect to the SDG 3 for maintaining good health and well-being of the people and the communities? What are the challenges, what are the like bottlenecks, what are the like roadblocks, and what are the solutions you can think of? Okay, so UN environment actually has listed like these three challenges and solutions, which are the typical solutions like at most of the places across the world. What are those? Environmental factors kill millions of people, like pollution, right, and like other stuff every year, causing nearly 1/4 of all deaths like worldwide. So you see like how big this whole problem is. 1/4 of annual deaths are because of environmental factors. Okay, so how essential now this has become. Now one can like take a call what this modernization and industrialization has really brought to our world. it's a question. I'm leaving it to your own judgment and pondering. Think about it. Well, solutions for this: avoid and reduce pollution to prevent millions of premature deaths like every year. Very simple. How to do is the question. Pollution, chemical exposure, climate change, and ultraviolet radiation. Okay, contribute to more than 100 diseases affecting primarily young children and elder people. So the most two vulnerable age groups, elderly and kids. Okay, they are prone to such conditions, and they get a variety of diseases, mentioning like 100 more than 100 disease types of diseases. Okay, so work with energy, transport, agriculture, industrial sector, create a healthier environment, because protection of environment is the most essential thing. It is this biome under which we are living, okay, is the only place which has given us this habitable conditions. Otherwise, beyond this is the most unhospitable conditions, like ISS, where it is flying, so you see, you cannot survive without such extreme this thing, right? At the bottom of oceans also we cannot survive, in the rivers, and we cannot live because we are not aquatic animals. Okay, in the deserts also it is very difficult to live and all that, right? But yeah, people are living over there. But if these conditions are increasing, for example drought and all of that, okay, so all of the other species, all of that of place like biodiversity is going to get a challenged, and again further it will become more inhabitable. So in terms of those things, lastly, air pollution is the world's largest environmental health risk, killing 6.5 million people. That means 65 lakhs prematurely every year. Air pollution alone, right? We know during the winter time, such health risks become very prevalent and very higher, and the huge volume of people actually start reporting such conditions. Okay, and if they are already having some pulmonary kind of conditions like asthma, etc., they find it even harder to cope in that kind of conditions. What to do? Adopt cleaner energy to reduce indoor and outdoor air pollution and save millions of lives. Very simple. How to do is the reason why we are undertaking this course, these lessons, and this is why UN has launched these set of SDGs. Okay, so these lessons what we are deriving from these these modules is carrying a potential in which we can empower ourselves to come up with a real and practical solution in our own localized conditions. Okay, so with this we have come to the end of this module. Thank you all for joining. See you in the next one.